Welcome, everybody. Thank you for joining us today. I'm Kelly Kimry with Cone Health, and I'm excited to have here with us Dr. Brian Sninsky, who is a board certified urologist, to do a presentation for all of us on men's health. So, Dr. Sninsky, I will go ahead and pass it over to you.
Thanks for having me. Like you said, I'm Dr. Sninsky. I'm one of the urologists. I primarily practice out of Burlington, but I also have an office in Mebane. And then Cone Health Urology has offices in Reedsville and in High Point as well. And then in Greensboro, the main urologists there are Alliance Urology that are sort of affiliated with us as well. But we can go ahead and go to the next slide. So what we'll talk about today are some kind of basic and common men's health issues, and then we'll make sure we leave plenty of time at the end if people have questions about any of the topics. But we'll start with kind of the hot topic, which is PSA screening and prostate cancer, and hopefully unravel some of the mystery around the PSA, which can be pretty confusing. Then we'll talk about kind of BPH or an enlarged prostate and urinary symptoms and different causes and treatments. We'll talk a little bit about kidney stones and diet strategies to prevent stones. We'll talk a little bit about low testosterone and ED. And then finally, I want to spend a decent amount of time on kind of diet and lifestyle. At the end of the day, everybody wants a magic pill or a magic lab test to fix things. But, what you eat every day and the activity and kind of your basic lifestyle stuff probably has a much bigger impact on your overall health and really all these topics. So we'll talk a lot about that and hopefully give you some resources to get more information about that too. So we can go to the next slide and start with prostate cancer. So the prostate is a gland that kind of sits below your bladder. The tube that you pee through goes through the prostate. It makes the ejaculate fluid that helps sperm survive for reproduction. So once you have kids, the prostate does not serve as big of a role. Prostate cancer is really common. About 1 in 8 men will get prostate cancer. But at the end of the day, men are still 10 times more likely to die from cardiovascular disease, so like a heart attack or a stroke. Prostate cancer rarely causes symptoms until it's advanced or metastatic. But it's very curable at an early asymptomatic stage. Typically that's radiation or surgery, but some of the low risk or slower growing prostate cancers can safely be watched. Early stage cancers that are found typically on a biopsy that are just in the prostate, those people do really well. So there's a better than 95% survival rate at 5 years, whereas that drops to like only 30% 5-year survival if we only find prostate cancer when it's already spread outside the prostate. So that's typically, somebody who comes into the ER and they have back pain and their PSA is like 500 and they have prostate cancer everywhere. That's much, much harder to fix compared to if your PSA is say 6 or 7, you don't have any symptoms and we find prostate cancer early when it's just in the prostate. So how do we find prostate cancer? That's the PSA blood test. So that stands for prostate specific antigen. It's just a blood test. It can be done by your primary doctor. It can be done by your urologist. It's not perfect. So just because the PSA is high doesn't mean that you have prostate cancer. There's lots of things that can cause that to be falsely elevated. The most common things would be like an enlarged prostate, inflammation or an infection in your prostate, like prostatitis can make the PSA go up. Even a recent ejaculation within 2 or 3 days can make your PSA be significantly elevated. Normal for most men under 70 would be less than 4. We always would repeat the blood test before we get too worked up about it, just because there's so many things that can make it bounce up and down. And then our job as urologists is to find those clinically significant prostate cancers that if we're untreated would ultimately lead to symptoms or death in the next 10 or 15 years. Prostate cancers, even the more aggressive ones tend to take years and years to spread. But our goal is obviously to find them early before people have symptoms when they're really fixable. So what happens if you have an elevated PSA? Well, first off, in terms of the PSA, we kind of divide people into two different categories. So people or patients that are high risk, African American folks are higher risk for prostate cancer, so they fall into that kind of high risk category. And then if patients have a family history of prostate cancer, or even breast or ovarian cancer, because that can be kind of related to prostate cancer, we typically would start checking the PSA blood test around age 40. If you don't have any of those risk factors, we typically would start around age 45 or 50. PSA testing is a little bit more of an art than a science. They've recently changed the guidelines just in the last year or two, so you'll see a lot of different things online about when you should start or how often. Again, high risk, so African American patients or people, if you have a family history of prostate cancer or breast cancer or ovarian cancer, we typically recommend at age 40. But then if you don't have those things, 45 or 50 is a reasonable time to start screening. It used to be we would check it maybe every year, every other year. Now, since prostate cancer tends to grow pretty slowly, we actually say to check that every 2 to 4 years, just because there's so many things that can cause those false positives that we talked about. It's tough. When you see your doctor, it's hard to get something checked every 2 to 4 years. So a lot of the primary doctors will still check it every 1 or 2 years, which, is not unreasonable. But the guidelines would say, every 2 to 4 years is probably reasonable. If you're higher risk, I'm probably going to check your PSA every 1 or 2 years, especially if it's borderline. There's actually some really good data that if you have a PSA less than 1 in your 60s, you're almost completely unlikely to die from prostate cancer. So that's always a good sign if your baseline first PSA is pretty low. Another common question we get is, when do we stop checking the PSA? Everybody's different. Some people are healthier than others, and we may check the PSA a little bit longer, but typically around age 70, we would stop checking the PSA. The reason behind that is, typically, even if you get prostate cancer in your 70s or 80s, you're going to pass away from something else before that ever gave you symptoms. So it's more something you die with as opposed to from. And again, like we talked about earlier, our job is to find clinically significant prostate cancers that are going to spread and give people problems, but without putting people through unnecessary testing or biopsies. So if your PSA is high, so if you have a PSA over 4 and you end up in our office or seeing a urologist somewhere, the first thing they're going to do is repeat the blood test. Again, so many things can make it be abnormal that we want to recheck it first. If you have 2 that are high that are above 4, typically there's kind of 2 options there. Classically, it used to be just a prostate biopsy, which is a procedure done in clinic. Takes about 5 or 10 minutes. It involves an ultrasound that's about the size of a finger that goes in the rectum, so it's uncomfortable. We put in some numbing medication and then take some biopsies of the prostate. Some people will say, I really don't want to do that unless I have to, which is understandable. And prostate MRI, has been pretty helpful, I'd say, in the last 5 or 10 years, where if you have a prostate MRI that's totally normal, we feel pretty comfortable skipping a biopsy and just monitoring your PSA. But if there's something abnormal on the MRI, we can set you up for a biopsy and we can actually target those exact spots. That's called an MRI fusion biopsy. And we're doing those now actually at our Mebane office. But those can be helpful. But either option is reasonable. Some people have a lot of other medical problems or are on blood thinners and they want to start with an MRI, which is super reasonable. Some people say, hey, I don't want to kick the can down the road and wait. I just want to do the biopsy, which is fine too. But everybody's different. If we did do a biopsy and you have prostate cancer, it comes in kind of all different types. So there's kind of a low, intermediate, and high risk type of prostate cancer. A lot of those low risk cancers are very, very unlikely to spread outside the prostate and give people problems. And so we can kind of watch those. That's called active surveillance. That typically means we check a PSA, sometimes a rectal exam every 6 or 12 months just to make sure that things aren't changing. Usually we'd repeat a biopsy within about 2 years to make sure that things aren't changing either. A lot of people will say, well, if I have prostate cancer, why wouldn't we just treat it? And the honest truth is that even in 2024, with all the technology and robotic prostate surgery and all that, people can still have long-term side effects from treatment, whether that's leakage of urine or problems with erections or urinary symptoms. So, we don't want to put people at risk of side effects or problems if they have a very slow-growing tumor that's never going to give them problems, even if they live to 80 or 90. And if things do change, we can always change our mind and move toward a more definitive treatment, but we've at least spared people 5 or 10 years of potential side effects. So if people have more of the intermediate or high risk type of tumors, then we lean toward either surgery or radiation. Surgery is pretty much all done robotically. That's like the Da Vinci robotic prostatectomy that you've probably heard about or seen in the news. Those take 3 or 4 hours. Typically, you go home the next day, a couple of small incisions. But even with the robotic surgery, maybe 10% of people at a year will still have trouble with leakage when they like cough or sneeze. And maybe 30 or 40% of people can have problems with erections still after that. Other treatment options are radiation. That's done by a radiation oncologist. That can either be radiation from the outside to treat the prostate, which is usually pretty well tolerated, or you may have heard of radiation seeds or brachytherapy, which is a pretty brief procedure where we actually put radioactive seeds in the prostate that kill the prostate cancer. The downside of radiation is you typically need at least 6 months of like a hormone treatment too, which can make people feel pretty run down. But everybody's different in terms of what their other medical problems are, what risk factors they have, what type of prostate cancer they have. And so what's right for one person, may not be right for another, but that's why, we kind of come up with a plan together. There's some newer treatments for prostate cancer like HIFU that you may have heard of, which is, high intensity focused ultrasound. I would still kind of consider that experimental. That's not really approved by the FDA to treat prostate cancer yet, but it's definitely being advertised out there right now. Some basic guidelines in terms of treatment options, typically younger, really healthy people like in their 40s or 50s, or if they have really high risk disease that's just in the prostate, a lot of times those people do better with surgery up front, because if things did come back, we could do radiation in the future. Whereas if we did radiation first and then prostate cancer comes back in 5 or 10 years, it's much harder to do surgery after you've had radiation. And then metastatic prostate cancer. So if prostate cancer has already spread outside the prostate, that's not treated with surgery. That's typically managed by a medical oncologist. They do chemotherapy, there's hormone blockers, there's immunotherapy, sometimes even radiation. But it's managed very differently than prostate cancer that's just in the prostate, which again, is why it's important to get your PSAs checked. So that's kind of the 30,000-foot overview of PSA testing and prostate cancer. We'll save questions till the end, but obviously happy to answer any questions about the PSA or prostate cancer stuff at the end. So we're already on the next slide there. BPH and urinary symptoms. So I think in the mainstream media and even from the primary care doctors, the prostate kind of always gets the blame when guys have any kind of urinary symptoms. But there's so many different things that can cause urinary symptoms in men that our job is to kind of figure out what that might be, or is it the prostate after all? So other things that can kind of overlap with an enlarged prostate symptoms are overactive bladder. Typically, that's more like urgency or frequency. Certain things that people eat or drink, definitely like diet drinks, can bother your bladder and give you frequency. Sleep apnea is actually a really common cause of nocturia, or getting up at night to pee. So for the patient, who doesn't really have any urinary problems during the day, but gets up 3 or 4 times at night, a lot of times the first step there is to be tested for sleep apnea. And if they do have sleep apnea and start using a CPAP machine, the overnight urination will completely go away. Diabetes definitely can contribute to urinary symptoms, whether people are on diabetes medications that put extra sugar in the urine and make people pee more often. And just diabetes itself can make people urinate more frequently, can also cause damage to the bladder kind of long term. So there's a lot of overlap there. Some of the basic stuff that I start with, any kind of diet drinks, artificially sweetened drinks, sodas, tea, coffee, energy drinks, caffeine, all that stuff can really bother people's bladder. Cut back what people drink 3 or 4 hours before they go to bed. That definitely can help. Try to empty your bladder right before you go to bed. They're simple things, but can definitely help. If people get swelling in their legs, at the end of the day, once they lay flat, that can recirculate and cause excess urination overnight too. Obesity. So if people are overweight, that's extra weight that's pushing on your bladder, and your bladder is just a water balloon that kind of expands and contracts to hold urine. And so when people lose weight, a lot of times their urinary symptoms get better just because their bladder holds urine better, and they can empty better. But if we do find out that your symptoms are more related to an enlarged prostate, there's lots of different medications out there and surgical options too that can help open up the prostate and get people urinating better. In terms of the medications, the most common one would be like Flomax. That helps relax the prostate. Another common one would be finasteride, which shrinks the prostate. But those can have side effects. There's a ton of different surgical options out there now that if people don't want to be on medications, or if they still have bad symptoms despite the medications, we can essentially open up the prostate to help people pee better. There's probably a dozen different types of ways to do that. Totally depends on, what size your prostate is, what type of symptoms you have, what your other risk factors are in terms of what might be best for you. A lot of times we'll do what's called a cystoscopy, which is where we look in your bladder in clinic to try to see how large the prostate is, or is there something else in the bladder causing symptoms. One last thing in terms of the bladder symptoms, overactive bladder, it's not just in women, men can have that too. That's typically more like urgency or frequency where people have to rush to the bathroom. That's typically treated more with medications, but definitely a lot of overlap with some of the urinary symptoms from BPH2. So we'll go to the next slide and talk a little bit about kidney stones. I'll try to get through the rest of my slides here. That way we have plenty of time for questions. Kidney stones are crystals that form in the urine. They can get stuck in the tube called the ureter that drains the kidney. That's when people have the classic kidney stone type of shooting pain in their back or groin. Most common cause would be dehydration, family history too. If your parents or siblings have kidney stones, you're at higher risk for kidney stones. If they're small, like less than 5 millimeters, they typically will pass on their own. But if they're bigger than that, we start to talk about surgical options to remove those. And the two most common would be either shockwave lithotripsy, which is basically trying to break stones up from the outside using sound waves, or ureteroscopy and a laser, which is where we drive a small camera up to the stone when patients are asleep and use a laser to break that up. Sometimes we have to put a stent in after that, which can be bothersome, but that only stays for a couple days or a week. Those are pretty common surgeries. The most common way that we treat kidney stones is with the ureteroscopy and the laser. That's an outpatient procedure. It takes about 30 minutes. People go home the same day. In terms of preventing kidney stones, a couple keys. Most important thing is drinking lots of fluids. Really, any kind of fluid is helpful. Probably should avoid the dark sodas. There's some studies that show that those can contribute to forming kidney stones. The best thing you could drink would be adding like lemon juice to your water, or even Crystal Light lemonade. Those things have citrate, which prevents stones. A low salt diet is very, very helpful. So calcium follows salt into the diet, into the urine, and that forms kidney stones. Unfortunately, all the things that are good have salt in them, like fast food and processed foods, those kind of things. So just take a peek at the food labels. A lot of times things have more salt than you realize. And then if you are somebody who forms a lot of kidney stones, you have to be careful. Certain foods can have a lot of oxalate, which form stones. And some of those are healthy foods. So like spinach, almonds, rhubarb, beets, those things can have a lot of oxalate. And if you are forming a lot of stones, maybe something to eat less of. We'll switch to the next slide here and talk a little bit about testosterone and ED. So testosterone definitely has been a hot topic over the last few years in terms of, you always see commercials either for pills that you can just get from like your GNC or the pharmacy, or like injections and other treatments. But it's controversial. Everybody's testosterone decreases as you get older, and that can cause symptoms like fatigue or decreased energy, weight gain, decreased sex drive, or problems with erections. They've come out with some new guidelines. So for us to legally be able to prescribe people testosterone, you have to have 2 levels that are less than 300 to be able to go on some kind of treatment. There's a lot of natural ways, though, to increase your testosterone besides just starting testosterone injections. So a healthy diet, probably more like a plant-based diet, actually, avoiding like red meat and dairy can help increase your testosterone. Getting enough exercise, especially like weightlifting activities or like heavier weight training as opposed to just going to the gym and doing like bicep curls, that kind of thing. Getting enough sleep, quitting smoking, decreasing your alcohol intake, decreasing your stress, all those things will make people's testosterone increase. A lot of times, if people have like a low vitamin D level, that can contribute to the testosterone being low as well. Um, Usually all my patients that I see for low testosterone, I recommend starting with some of the lifestyle and diet things first, because once you go on testosterone, your body kind of stops making its own testosterone. And so people can become dependent on that. So definitely for guys in their 20s, 30s, or 40s, I want them to start more with lifestyle stuff as opposed to a medication. The other thing is if we put you on testosterone, people will become infertile actually because your body says, hey, I've got enough testosterone. I don't need to make any more. I don't need to make sperm. And so if people are still interested in having kids, going on testosterone is definitely not a good option. At the end of the day, the testosterone level is just a number. We're much more interested in how you feel and how you function on a day-to-day basis. And so I wouldn't put too much stock into just one blood test. There's so many things that go into how people feel on a day-to-day basis. And all those symptoms can overlap with other things, whether people are stressed, they're not sleeping well, they have depression, other medications can cause those side effects. So again, it's complicated. Going on, or I guess we're still on this slide, in terms of erections, problems with erections are really common as people get older. More than 50% of people will have problems with erection over the age of 50, and almost 3/4 of those people is caused by vascular disease or blood vessel damage. Erections are just blood flow that gets trapped in the penis, and so once your blood vessels get damaged, whether it's through your diet or smoking or being overweight or diabetes, all those things have a negative impact on the erections. So, like we talked about a little bit with the testosterone, more of a plant-based diet, less dairy, less red meat, getting enough exercise, all those things will help people's erections. And usually within just a few days of weeks of making some of those changes, people can see a difference. Medication wise, in terms of erections, everybody's seen the commercials for Cialis and Viagra. They're both generic now, so they're a lot less expensive than they used to be. Those can be prescribed by your primary doctor or a urologist. They essentially improve blood flow to the penis. They can have some side effects like a headache or stuffy nose, muscle aches, but overall they're very safe. Really, the main contraindication there would be nitrates for chest pain. You can't take those together because they can cause low blood pressure. And then I strongly recommend that people avoid kind of the over-the-counter supplements or like testosterone boosters. Those things aren't regulated by the FDA, so no one really knows what's in there. At the end, it's probably mostly advertising, so you can't really put much stock into those. And sometimes they can even have prescription medications that can cause bad side effects or interactions with other medications that you take. So would not recommend that. So we'll go to the last slide and touch on this briefly, and then hopefully leave at least a little bit of time for questions, and we'll go from there. So like we've touched on a few times, I'm a big believer in diet and lifestyle. Obviously there's lots of medications out there. There's lots of surgeries out there, but at the end of the day, if you eat a healthy diet and you exercise and you get good sleep, that's going to do a lot more for your health than anything that I can prescribe you or any procedure that we can do. Again, prostate cancer common, but you're still 10 times more likely to die from a heart attack or stroke. So anything that is healthy for your heart is probably going to be good for your prostate. I don't really recommend any specific like prostate diet or prostate supplement. Again, I'm a big believer in more of a plant-based diet, so less red meat, less dairy, less processed foods. Those things are going to make people feel much better and be much healthier and live longer. There's a lot of really good data that even if you have high blood pressure, if you have diabetes, if you have low testosterone, problems with erections, those things can be reversed with big changes in diet as opposed to just medications. It doesn't have to be all or nothing. So I'm not saying you have to go totally vegan, but even if you decrease your meat or dairy intake to maybe just once or twice a week from, multiple times a day, that can have a big impact on how you feel and your overall quality of life. Quitting smoking, decreasing alcohol intake, those things definitely help people feel better, decreases the risk of all types of cancer, of cardiovascular disease, and improves people's overall health. I think the really simple formula for being healthy, try to walk 7,500 to 10,000 steps a day, have a plant-based diet, exercise with weights 2 or 3 times a week. Those are the three best things you can do to live a long time, feel good, be healthy, not get prostate cancer or urinary symptoms. I think in terms of some other resources, forksoverknives.com is a good website that has a lot about kind of the plant-based diet and how that helps people. And then there's a couple really good documentaries. I think some of those are on Netflix or Hulu, either The Game Changers or Forks Over Knives. I definitely would recommend. It's an hour and a half of your time, but can make a big change on your overall quality of life and just how you feel. But I know that's a whirlwind 27-minute overview of some basic men's health and urology issues, but happy to open the floor to answer any questions that people have. Primary care doctors can check your PSA. They can check your testosterone levels. We're more than happy to see people to talk about those things too. That's a good contact number for our office. And, I personally see patients in either Burlington or Mebane. And I'm happy to see people in clinic too to talk about any of these issues.
Does anybody have any questions for Dr. Sninsky?
People can put questions in the chat too if you don't want to say anything on the video.
No? All right. Well, I know I learned a lot today, so thank you so much. It was great information. We are so delighted to have you and to share your wealth of knowledge. Thank you all for attending and coming over and taking part of this Men's Health Week webinar. We appreciate your time. I did record it, so if you couldn't get everything in it, I will share that with you as well. Dr. Sninsky, do you have anything else?
No, I think in 2024, everybody loves the instant gratification, the Twitter, the Instagram, the TV, the internet. But at the end of the day, I think to make those changes, you have to make things a habit. And, taking one pill or doing something different for 1 day or 2 days, isn't going to make a difference. But if you can make some major lifestyle changes, again, not an all or nothing thing, but if you can walk, 7,500 or 10,000 steps, if you can eat more of a plant-based diet, quit smoking, avoid some of those processed foods or a lot of red meat and dairy, you're going to feel better. You're not going to get prostate cancer. And those are things that are going to make a much bigger impact on your health than any kind of over-the-counter supplement or medication that really any doctor can prescribe you.
Wonderful. Well, thank you everybody for your time today. Thank you, Dr. Sninsky, as well. And I hope you all stay well, and we look forward to the next time we're able to share a webinar with you. Take care.